So what are the main differences you've noticed between being a PA, a family PA in the US, or specifically California, versus here in Canada?
Yeah, so it's quite a bit different. It's mainly the scope of practice and the acceptance and the understanding of patients and other healthcare providers and government for sure. Again, it's very difficult because you're comparing with one place who's had physician assistants for 50 years and another place who we have had them here for 10 years, but it hasn't been a great number practicing for 10 years. So there's such a small number of physician assistants that are coming out. It's much more difficult, I think, for us to make a huge impact very quickly. That being said, it was a slow process through the States too, and I wasn't around at the beginning of the process, so I'm sure if you talk to some of those people, they'd be very similar stories of it being kind of a slow pattern. Some of the differences, so in the States we do have, at least in California, we have DEA numbers, which allow you to prescribe narcotics, so that's a big difference between Ontario and California specifically. Sometimes the medical directives are a little bit different that we use here in Ontario versus like more of a practice agreement type of delegation of services in California. And I would say just the reimbursement is one of the other biggest concerns, is that we had specific billing numbers in California so we could bill for the services for the insurance companies and to the Medicare and Medi-Cal programs, the government programs, where we don't have a really good funding model yet here in Ontario.
And was there a big difference between how you functioned in your day-to-day activities as a PA in California versus here in Ontario?
No, I would say it's quite similar to how I function daily. At the practice in California, I was fairly autonomous. The physicians were in the office most of the time, but they were running with their own list of patients as well. So if I needed them, I was able to ask them a question at the end of the day or the end of the week, but there wasn't a lot of interaction. Here I find that there has been a bit more interaction, and it's just been because it's a newer role. So as the physicians I'm working with are learning and understanding the scope of practice, as they're teaching me all the nuances here in Ontario of, you can't get an MRI tomorrow for a shoulder rotator cuff tear, which was one of the fun things I learned in my first week at the clinic at Stone Church. So I think it's just learning the different ways to navigate the system and where you can find what and what type of specialists will do different things. I wasn't used to, for example, orthopedic surgeons only doing shoulders or only doing knees. The company that we used to send patients in California did a pretty wide spectrum of orthopedics. So different nuances like that, and just kind of a little bit more teamwork here, which I really do love. I get to work with dietitians, mental health counselors, pharmacists, lots of different roles, nurse practitioners. So it's a little bit more diverse with the collaborative care, which I really enjoy.
And as an American PA, was it difficult to find work as a PA in Canada?
So I had a really unique experience because I was brought here to help with the teaching for the program. So I had like a specific visa to teach for the program. I'm not sure exactly how easy or challenging it is for other Americans if they're interested in coming up. I do get contacted quite frequently by other Americans that are interested or that have family up here in Canada. If they are Canadian citizens, it's much easier. If they were just an American citizen wanting to move up here to practice, they would need to get some type of work visa, and their work would have to sponsor them to bring them up, which could be possible, but would probably be expensive and a fairly lengthy process. The other thing too is the Ontario PAs a lot of times are looking for work, so it's trying to make sure that it's a job that somebody can't do that's already here in Ontario.